All right, now we're going to talk about ulcerative colitis. So what's really important about this condition, this is a group of two category of conditions. They're called IBD, inflammatory bowel diseases. We'll talk about the other one on a different video. So this condition, when we talk about inflammatory bowel disease, these are irreversible conditions, meaning that when the symptoms subside and go into remission, there is still a possibility of a relapse of the symptoms or the condition, okay? Unlike the other condition that we talked about in the previous video, the irritable bowel syndrome, whenever the symptoms subside, they can be gone forever. But ulcerative colitis and another condition called Crohn's, these are referred to as the inflammatory bowel diseases, where these conditions can go into remission, however, they can come back and as severe as they want to be, depending on the degree. So what can cause this? So this is a form of an autoimmune disease. It's an autoimmune disease. What is an autoimmune disease? When the body attacks itself. And so when we talk about autoimmune diseases specifically here, what are usually the signs and symptoms of ulcerative colitis? So instances of gastritis, excessive diarrhea, gas buildup in your stomach. But one of the biggest thing is ulcers. So you have these giant ulcers that are created in your colon, specifically in the large intestine, right? Specifically there. So when we have these ulcers, so what are ulcers? Ulcers are these little sores. These sores at opening in parts of the digestive tract. Now, why is that dangerous? Why would these ulcers be dangerous? Well, first of all, they prevent the actual proper function of the colon, right? So the whole process of different material. But also another thing is when you have these sores open up, if they become very deep, they can become an opening. What's in your colon? You have a lot of bacteria in your colon. It's good bacteria in a sense because it's contained and it creates all the material that you need. But if that bacteria enters your bloodstream, these patients experience what? What is that called whenever it enters your bloodstream? The bacteria. It causes a systemic infection. It's called sepsis. So these patients have this problem. Now, is it reversible? It depends on what you define as reversible. Can it go into remission? Yeah, sure it can, with proper treatment. So because it's an autoimmune disease and it's a buildup of inflammation, what do you think the treatment procedure for these patients are? What would they treat these patients with? So you can give either some kind of anti-inflammatory or immunosuppressants. So those are two drugs. One drug of choice that they use as a standard is prednisone. And prednisone helps with the decrease in inflammation. Perfect example. My boss's wife has ulcerative colitis, and she had these problems, the instances of gastritis and everything. But prednisone, she was a very holistic person. She wanted to go into a naturopathic route. So she didn't believe in medication, because even though some patients that take prednisone notice that after even the symptoms subside, there is a proper transmittance of relapse, right? And so they want to kill it and prevent this from coming in the first place. So her situation was, what triggered her ulcerative colitis was certain food groups like dairies, gluten in diets. And so this was a big problem and it was annoying. It's one of those very annoying problems. So she read about and taught me to take this drug called VSL3. VSL3 is this probiotic, very, very high degree dose of probiotics that they prescribe now for patients with any kind of irritable bowel, either irritable bowel syndromes, but in more cases, the inflammatory bowel diseases. So VSL3 is this high concentration of bacteria, so about 130 to about 150 per capsule, and she would take about 5 to 6 of them. So the reason why is, remember, our colon has how many bacteria? Trillions and trillions of bacteria. So what the natural probiotics that you usually get, for example, from the whole food stores, or like Jimbo, Sprouts, Henry's, those probiotics are so low. But here, in this case, when we look at the VSL drug here, this drug actually gives you such a high dose. And so it's really important to really look at what's going on. And again, like I said before, $50 per a bottle a month, right? And so when you said you want to put a price on health, there's no such thing, right? And it's all relevant. So $50 a month, you can get VSL3 and you can feel better from your ulcerative colitis.